Oklahoma is falling short in passing legislation and developing supportive policies to prevent and reduce suffering and death from cancer. That is the lead sentence in a new study from the American Cancer Society. The study comes out at a time when the state is on the verge of some major developments in the fight against cancer.
Oklahoma State and Metropolitan Boards of Health are now pushing the legislature to increase the tax on tobacco products, something that has widespread support from people who spend every day facing the impact of tobacco use.
The last time I believe that we had a cigarette tax increase was in 2004. We're at $1.03 now.
Don Watson is Government Relations Director for the American Cancer Society Action Network. In recent weeks, the organization released a new study that shows that this year, more than 19,000 Oklahomans will be diagnosed with cancer, and more than 8,000 will die from it.
Of the people in Oklahoma today, 1 out of 2 men and 1 out of 3 women will develop cancer sometime in their life.
Dr. Robert Mannel is director of the Stevenson Cancer Center at the OU Health Sciences Center, a facility that has become the focus of the battle against cancer and to lead the way toward a healthier state.
Education's a huge component of it. And so being out there as a cancer center, and certainly one of our goals and one of our missions is to serve as an education resource for the citizens of Oklahoma.
An education that is designed to change behaviors in several ways.
We rank 50th of the 50 states in consumption of fruits and vegetables per capita, and that's a major problem when it comes to the type of diet which can be healthy and prevent cancer.
Oklahoma also ranks at the bottom for exercise rates, which, coupled with poor diet, creates a major obesity problem. Helping in all of those areas while focused primarily on someday ending the use of tobacco in Oklahoma, the Tobacco Settlement Endowment Trust's Executive Director Tracy Strader has some good news.
In 2001, our smoking prevalence was 28.7%. Today, new figure is 21.1%. That's really a huge drop. It's taken us many years to get there.
And while that is still above the national rate, it is the state's lowest smoking rate in history, due in large part to the work of the Tobacco Trust.
Even though we are going that longer, slower road, and we're going business by business and city by city and school by school, what's happening is we're creating healthy conversations around this state.
Through millions of dollars in grants, TSET is funding programs to bring more physicians to rural Oklahoma, help communities get healthier, fund health system grants targeting tobacco, obesity, prevention programs, mental health, and substance abuse treatment providers. It also funds tobacco cessation programs through the Oklahoma Health Care Authority for people on Medicaid.
They can call into the Oklahoma Tobacco Helpline and get up to 5 coaching calls and then unlimited inbound calls. So they can call in and say, hey, I'm struggling, help me. And so we do cover that, and then through the helpline they can get 2 weeks free of the patch, the gum, or the lozenge.
Kelly Willingham is a health promotion coordinator at the Oklahoma Health Care Authority. The Tobacco Helpline is open to every tobacco user in Oklahoma paid for by the Settlement Trust. And doctors can get reimbursed for doing tobacco cessation counseling with their patients.
It's one of the best things Oklahomans did is put that to a vote and say that this trust cannot be touched and it can only be used to better the health of Oklahomans. And I think we have the money, and I think they're doing a really good job about deciding where to spend it.
It was also money from TSET that helped move the state much further down the road toward real medical breakthroughs in cancer treatment.
Because of our funding to the Stevenson Cancer Center, their Phase 1 clinical trials program is now in the top 10 in the country. And, you know, it used to be that people wouldn't even discuss Oklahoma when it came to cancer treatment or clinical trials.
Clinical trials that are also number 3 in the nation for the number of people receiving treatment.
What that means is the citizens of Oklahoma have access to the latest drugs and the latest therapy without having to leave the state.
Oklahomans from every county in the state have now received treatments at the Stevenson Cancer Center, treatments that were not available just a few years ago. The center is now closing in on seeking designation from the National Cancer Institute as a designated cancer center. Oklahoma is one of 16 states that does not have an NCI designated center.
We do have one of the most unhealthy states in the nation, and there are many things that we could do. Sometimes they don't happen, sometimes we have to keep working at it, and that's just what we're doing.